Okay, good afternoon. My name is Helene. It's my pleasure to be here today as the moderator of this panel on replicating the GAVI success story. And we're going to get into a lot more detail about GAVI and really have an exciting panel. But yeah, just to say this is the 10th year anniversary of the launch of GAVI. And in the 10 years, GAVI has had some incredible successes that you'll hear about, like the 5 million lives that have been saved as a result of GAVI and the 250 million children who have been immunized in some of the world's poorest countries. So today we're here because we want to talk about some of the lessons that have been learned through the experience with GAVI, look at what this model offers us, and also think a little bit about whether or not this is a model that might be useful for attacking some of the other health challenges that we face around the world, particularly as we look at trying to decrease the disparities of health between rich and poor nations. So let me just introduce our panelists, and then we're going to see a video that shows some highlights of GAVI and gives a background, and then we're going to get it right into the question and answer. So first of all, to my extreme left is Dick Clark, who is the chairman, president, and CEO of Merck and Company. As I'm sure everyone knows, Merck has made a substantial contribution as a pharmaceutical company, but one particularly that has had a strong focus on vaccines for many years. Next, Melinda French Gates, the co-chair of the Bill and Melinda Gates Foundation. Bill and Melinda Gates Foundation has made a strong contribution not only to GAVI and vaccines, but to global health overall. Next is Julian Lob-Levyt, who is the CEO of the GAVI Alliance. And finally, the Honorable David Mwakyusa, the Minister of Health and Social Welfare of Tanzania. So we have a very distinguished panel who will be able to speak to this from a variety of different perspectives. But before we start with our discussion, let's go to the first video.
In the poor countries of the world, my brothers and sisters are dying needlessly. It's a tragedy for us, our families, and for our countries too. But it is a tragedy that vaccines can end. Vaccines are a miracle thing.
GAVI, the Global Alliance for Vaccines and Immunization, has the tall ambition of protecting every child against killer diseases, and thus lay the foundation for personal development, social development, and eventually renewed economic development for entire societies.
Vaccines first started to reach us in the 1970s. Many children got immunized in the 1980s. But the story has a twist. In the 1990s, vaccination coverage started falling. Less children got immunized. Millions of my brothers and sisters who died could have been saved. To get our immunization back on track, a new idea was urgently needed.
We need cooperation from lots of groups. We need the governments in the developed world to pitch in. In order to make it all happen, we need governments in the countries where the vaccinations need to be delivered to pitch in. We need the pharmaceutical industry. So we're just getting the critical mass.
Everyone did pitch in. Over the following 10 years, things got better.
If we didn't know it before, we now know that the single largest contributor to poverty and the single most vulnerable aspect is in fact health. Is it better to treat people when they're sick, or is it better to try and stop them getting sick?
We need to make sure that we have the expertise and the capacity and reach all of these children. By bringing together those of us who are on the ground, those who can make sure that the quality and the overall policy is there, leaders of countries, here is a broad-based, strong alliance giving a very high priority to this. We really can make a difference.
I don't think there's any doubt that as a result of undertaking this initiative, that there will be an increase in the healthcare infrastructure and the primary care delivery system that exists in every one of the countries that participates. And this is absolutely essential. And when you put together all of those elements, I think that it will create a large market, will draw in even more companies, more competition of ideas and research knowledge.
It's the real interest of investors to help and eradicate these diseases. So I think that creating conditions so that we bring in development to the interest of everybody is very important.
You must have the political will in the countries to be able to deal with these questions. You have to have the infrastructure. You have to have the support locally. You have to have the focus on health.
In 2006, GAVI found new ways to fund vaccines, enabling spending on our immunization to double. After 10 years, the numbers speak for themselves. The alliance partners are delivering on their promises. But our biggest enemies, pneumonia and diarrhea, remain unconquered. The demand is there, and the vaccines are available. Yet, my brothers and sisters still die every year of diseases that can be prevented. Your children are vaccinated. Why not ours too?
Great. Well, I hope that sets the scene for the discussion that we're going to have, and I think that last question in some ways really says it all. Before I go to Julian, who I'm going to ask the first question, I also just wanted to mention one panelist who's not able to be here, Margaret Chan, the Director General of WHO, who really wanted to be part of this panel. WHO is a strong partner in this, but unfortunately she had a death in her family. So just to know that she wanted very much to be here to represent the UN system and their commitment. So Julian, set the stage and give us a little foundation. Say a little bit about what have been the drivers of success. This video talks a lot about the things that GAVI has been able to accomplish. What's been responsible for some of the successes? What have been some of the factors, and what have we learned from the GAVI experience?
Yeah, I mean, you've seen some of the figures in terms of the results, the latest figures from WHO, some 5 million children's future deaths have been prevented. Those are very important figures and good contributions to achieving the Millennium Development Goals. And I think it's quite interesting when you look at that video from 10 years ago, not only to see how people have got more grey hairs after 10 years, but also those commitments that were made at that time, and how many have been met and some that haven't, and some of those challenges that still remain there. And I think I'm very interested in this debate to go into some of those challenges. We'll come back to those. I know you're going to, I hope you'll press us on that. But I think some of the factors in the success of GAVI have been, and it was groundbreaking when it started. We've forgotten, we've since had the Global Fund for AIDS, TB, Malaria and others, which was sort of inspired by GAVI, this very unique public-private partnership that was created, an alliance of the major actors involved in immunisation, working together to a single mission and a single goal, and delivering results, and attempting to build an organisation that also worked in a different way, in that we kept a fairly lean structure and relied very heavily on countries themselves and the partners working at the country level to then deliver the results that we've heard about. And that's been challenging, but I think in a large part has delivered. I think the other thing that we've had, and more recently that's been made firmer, is that as we've built an alliance that has gradually got a clearer governance structure and greater accountabilities, we're also beginning to see the importance of the private dynamic in that debate. In that our board at the moment, 1/3 of our members come from the private sector, people that come out of the financial markets, that come with an independent and challenging mind, and bringing that dynamic in is very vital. But also, let's go back to how it was started. I mean, let's be honest, without Bill and Melinda's contribution, GAVI would not have existed. It required that vision to kickstart a different way of thinking and then to build in all the other donor support since then. And the announcements that you just made today of another major investment in immunization more broadly, $1 billion a year for 10 years, $10 billion US dollars, is again going to drive that momentum.
You touched on it, but say a little bit about why it's an alliance. Who is it an alliance of? And just for people who don't know, what does it really mean and who are the partners? Because I think that's important.
Yeah, no, thanks, Helene, because I've been in this for so long now, I can assume that everybody knows what GAVI is. But GAVI is an alliance of the major multilateral agencies, principally WHO and UNICEF and the World Bank, the Bill and Melinda Gates Foundation, of course, but also developing countries. So a strong representation of what are called the recipient countries, the partners who actually deliver the programs, and the donors. Then industry, which was quite a breakthrough, having industry north and south, so from emerging market suppliers and then from this sort of industrialized north, added a new dimension to the debate. Civil society sitting with us, and then lastly the sort of research community, and as I mentioned, the sort of independent private. So that's the kind of construction of this rather unique alliance. And I'll be honest, and again, forgive me, those of you that come from some of these institutions, part of the downturn that we saw in immunisation coverage was partly, it was very individual-driven. Great leadership from an individual such as James Grant in UNICEF. And then when that man sadly died and priorities changed, it didn't turn out to be sustainable, perhaps. And I think that's what GAVI's brought in, is bringing institutions together with a more incremental approach, rather than throw the money at it, get that huge peak in coverage and then not be clear how it's going to be sustained and build the necessary system. That created a different way of working. But it also, alliances are not easy. There's tensions in alliances. You've got to work at them. You've got to build trust. You've got to have a common vision. And it's not a given, and it's hard work. And to sustain an alliance with that common vision is important. I think GAVI's made great progress in that direction. Again, if I'm honest, there was competition between agencies in the past, where it was WHO, UNICEF, and the World Bank. That's gone. There's much clearer understanding of respective roles and responsibilities of agencies. Therefore, I think the add together the sum of the parts and the whole is significantly greater.
Yeah, and having that buy-in of the alliance partners means that you kind of keep the commitment strong, and it doesn't rely on one organization or the other to have that commitment. Melinda, a lot of deserved credit has gone to you and Bill and Melinda Gates Foundation for the incredible, not only the financial commitment, but as Julian said, the vision to make that kind of investment. But I also know that you don't make investments like that without a lot of thought going into why this versus another. Say a little bit about why early on you and Bill and the foundation took a big bet on GAVI and thought that this was something that could make a difference.
Well, when Bill and I were just very, very early thinking about getting into the health arena and we were trying to learn, we read this article that just really took us aback, to be quite honest. This article about, 500,000 kids dying a year in the world of diarrhea. And you just say to yourself, no, wait a minute. I live in Seattle. I travel to places like London or Paris. Kids don't die of diarrhea. How can this be happening? What is it that allows this to go on? And why isn't somebody doing something about it? There must be somebody tackling this. And the more we came to learn about it and what the market failures were and why there weren't incentives for the drug companies to actually create a vaccine for the developing world, we said, there has to be something that can be done about this. And we had this key dinner at our house with some scientists where we just committed an amount of money to do childhood vaccination because we were stunned also to see that the vaccination rates, that you had this system, but for whatever reason it was crumbling around the world. And at the end of the dinner, after a lot of discussion about vaccines and childhood deaths, I remember Bill leaving the scientists. We thought we were done. And right after dessert, where everybody's ready to go, and he says, I just want to leave you with one thought, and that is, how do we think big about this problem? And when I think now about GAVI and what has been created by this partnership the last 10 years, and to sit and watch, okay, this thing got launched 10 years ago, and say, this was thinking big. Mm-hmm. And it was thinking big about saying, here's a goal that we have as a world, and let's pull the partnerships together, and let's figure out who can slot in the different ways. So Bill and I initially thought, okay, we'll make this $750 million investment over 5 years, but it went honestly so well the first 5 years, and there were tweaks, there were things that I needed to get reshaped, but we had confidence, so we put down a second bet of $750 million over 10 years, with the idea that we knew governments were coming in and that, our money may look big in this, but we have to be honest, it's not. It's government funding. And so many of the things that make this work, and now we've got this amazing rotavirus vaccine that is just now being delivered in places like Nicaragua, and that's going to spread all over the world. And GAVI's been huge, and WHO and UNICEF all in partnership about getting the financing organized, getting the technical approval, and actually getting it out on the ground in the countries. We're going to bring down the childhood death rate because of these vaccines. And so when you say that and you look at how inexpensive it is, it makes us want to invest all the more.
Yeah. No, it's an inspirational story, and we're going to get back to the story of Nicaragua and rotavirus a little bit later on in the session. Turning to Dick Clark for a minute, Merck has a long history of investment in vaccines, and it's really been laudable. But, GAVI has really been something different, I think, in many ways. What were the kind of incentives for you from an industry perspective that made you feel like GAVI was a model that was worth being involved in? And what have you seen from your experience as working with GAVI?
Well, certainly, and it's already been discussed, the issue around the funding capability and the reliability of funding, the political will, and the infrastructure that you need in countries in order to deliver vaccines to the children, the clinics, has been put in place. But from a manufacturer standpoint, able to have reliable demand forecast, be able to go back into research and plan, to be able to build vaccine facilities, which takes years and years and billions of dollars, is very important to us so that we can meet the demands of the developing world. And with the advanced marketing commitment pilot, our ability now to go back for a pneumococcal vaccine, for example, and begin the planning and do it differently. So in fact, we just signed an agreement with Biological E, which is an Indian pharmaceutical company, to have them think about development and manufacturing for the developing world. We would have never done it that far in advance if it wasn't for the success of GAVI. When we formed the Helene Institute, which is a joint venture between Wellcome Trust and Merck to form a joint venture, nonprofit research capability in India in order to start working on developing world vaccines today and to optimize the current vaccines, we would not have thought of that in the past. And so you have to give GAVI and the inspiration and the mission they have to really have the pharmaceutical companies think differently about this, and I think we're doing that.
So all of this doesn't really matter unless at the country level it really is making a difference, and it's really driving up immunization rates and really changing the changing mortality rates of children in the community. So from a country's perspective, Minister, what has GAVI meant to you? What have been some of the lessons learned? And are there ways that you think GAVI could continue to even more strengthen the ability to increase immunization rates and save children's lives?
Well, thank you, Helene. Our country is committed to attain the MDG4. And if things are going the way they are, we certainly will. There are declines which are very encouraging. If you look at the rates of 1999 and compare them with the demographic and household survey, which we did 2 years ago, there is a 38% drop in the mortality of the under fives and a 41% drop in the infant rate. We're not doing very well with the neonates, but that is probably related to a high mortality rate that we have. These gains have been attributed to a lot of interventions that were taking place. I mean, we have vitamin A, IMCI, and so on and so forth. But the one we think that has really made the difference is immunization. We have maintained a high immunization rate, and you find that some of the diseases which were commonplace, it's difficult to find them there. In our main hospital, we used to have a measles ward, and now we are finding it difficult to get a measles patient to teach our medical students. Even diphtheria, pertussis, or tetanus, they are also hard to come by. So if the mortality has declined, I think it's because of the cost effectiveness of immunization, and thanks to GAVI. GAVI came on the scene, I think, in 2000. We were one of the first countries to make an application and got funded in 2001. And since then, I think many such initiatives have to learn from GAVI, because their support is, I mean, is timely and predictable. When you have an initiative like that, you think something which is predictable, and that is what we get from GAVI. So we find that the immunization rates have been coming up. Actually, the least of all is 84%. In some of them, we go right up to 90%. But also, when new vaccines came on the scene, they were there to help us. We've been able to immunize 88% of our kids with HBV. And what does it mean? 10 years on the line, we are going to get less and less hepatocellular carcinomas. And that is something to be proud of. Last year, we had Haemophilus influenza vaccine, and we vaccinated 80% of our kids. And it means the pneumonias which we are taking our patients, maybe now they are going to become a history. This year, we are planning to put into our EPI the pneumococcal, and next year, the rotavirus. But they have also helped us with the immunization support in terms of training and logistics and even vehicles. They have helped us, and also the injection materials to have the new type of injections, which is very important in our area. Otherwise, you are going to transmit HIV or other diseases if you're not careful with injections. So
the auto-destruction that you can only do one. Yeah.
And you can't use it anymore. And also, we have an ongoing, what we call the Reach Every District strategy, or Reach Every Child strategy. When we do the vaccination and go back to see how we have done, you find that there are some districts which are less performing. So we go back to vaccinate, and that has helped us a lot. But I would say in the financing, the country also does, for every initiative that we do, anything that goes into my budget, there is a budget line from the government. And I would like to see that increasing every year. For instance, when we had the pentavalent vaccine in 2008, we spent $1 million US, and that's no little money for a country like mine. So we make sure that we are not completely reliant, so that one day GAVI will say, you go on your own, we should not be left in a vacuum. So we are grateful to GAVI, and very much so, because of this sustainable type of support. Our appeal is that when new vaccines come on board, they take too long to reach our countries. Actually, the pneumococcal, for instance, the studies were done in Africa, but we are the last to receive them. So we can think about that. And also, you visited our country. We've been talking about immunizable diseases. Some of you may not know that cancer of the cervix is a big killer in my country. Actually, 47% of all the cancers, children, male, female, is cervical cancer. And we know what causes cervical cancer. We know we can immunize. We know we have serological tests. So my appeal is, we need to find some mechanism to help us. We are the needy, but we are the ones who are least prepared actually to handle a situation like that.
Yeah, we may want to come back and talk about the situation of HPV, but this has been kind of a GAVI love fest. It has been great, and there have been some incredible successes, but obviously this has also had some bumps along the road. Julian, maybe say a little bit about some of the things as you look back that could have been done differently. What are some of the lessons that are learned, things that you think could have improved how GAVI functions and things that you're thinking about moving forward.
I think one of the areas that perhaps we underestimated in the early days was the speed by which vaccines could become affordable, because our first set of vaccines that we introduced were quite pricey. As the Minister has pointed out, this isn't a free lunch. And the way GAVI works is that countries co-finance according to ability to pay. But over the short timeframes that we had, it was rather uncertain about what was the exit strategy and was this going to be feasible? Was this sustainable? Were we putting budgetary time bombs into the government of Tanzania, putting in a vaccine, and GAVI wouldn't be there 3 or 4 or 5 years later, and then who's going to pay for the vaccine? Now, we learnt about that, and I think one of the things we have done is that we've taken a much longer time frame, a longer vision, so commitments of 10 years of financing, again from the Bill and Melinda Gates Foundation, but also the International Financing Facility for Immunization, which came on stream sort of 3 years ago, an innovative financing instrument that gives long-term, legally binding, predictable financing from donors. We raise it on the bond, from the capital markets as bonds, but it allows us to enter into multi-year agreements with governments. Now, if I was a Minister of Health or a Minister of Finance, I would be enormously reluctant to take on some of these products unless I knew this was not a fly-by-night project. And I think in the early days of GAVI, there was some uncertainty, would we be here in the long term? And I think that's completely changed. And that allows ministries of health to have ambition and to scale up. But also, I think, for industry. Industry now sees there's a market that's been created. There's one they can have confidence in, that you can have the confidence to invest in, to go forward. And I think we're still unpacking some of those dynamics. How can we shift prices in those kinds of areas? I'll stop there, because I think those are some of the key issues that we've struggled with. I think the other, though, has been perhaps about understanding what is the necessary platform. Everybody talks about health systems and everybody either falls asleep or says, what are we talking about? It's a big black hole. I tend to talk about what is the delivery platform for an intervention that at the end of the day is going to be the same 3, 4 or 5 health workers in the district who've got to do it, and they've got to do the antenatal care, they have to do the HIV, TB, malaria, they have to do the vaccines. How can we more effectively think about what are those delivery platforms? Because that's part of the sustainability answer. We need those kind of platforms to ensure the vaccines continue to get out. And in many countries we've had successes, but in others it remains for me uncertain where that sustainability will be.
Yeah, and I think it raises a good issue that some of the critique or at least observations about GAVI is that this is based on a very product-driven health intervention. Is the rest of what needs to happen to increase immunization rates actually happening? Is GAVI the right mechanism for the systems piece of it? And what can GAVI contribute to it? And where does that stop? And then how do you make the links to the rest of what needs to be done for health system strengthening? And maybe you might want to comment on that, Minister.
Yeah, if I heard you correctly, you said it's a product-driven initiative. I would say it's not purely product-driven, because when I was saying a few minutes ago, they have helped us with institutional support to try to get the vaccines in cold chain. Our people live out there in the villages, and to get the vaccines in Dar es Salaam is not getting the vaccine to the people who need it. So they have provided us with vehicles, they have helped us training our people. So what I would say is, much like we were talking with the Global Fund, they were disease-specific, but we took them on board to come and talk about health system strengthening. I think GAVI are doing that as well.
And I think that's a piece that often gets forgotten in this, that in fact GAVI is not just a funding mechanism. It's not just about getting a vaccine to the place, but it's really looking at the whole piece in the system.
Yes, I just wanted to add and echo the comments that are being made here. I just was in Malawi, actually in Benin, earlier this week, and in particularly Malawi, I went out to see several things because of some of the great work they've done to get their childhood deaths of kids under 5 has really they've been ticking away at it year after year after year, and they're one of the only 2 countries in Africa that's likely going to meet the Millennium Development Goal of reducing childhood deaths by 2/3 by 2015. And so I wanted to understand better what they're doing and see some of the partners' work. And when you get out there and see what they're doing, so this is a country that's, one of the bottom 10 countries in sub-Saharan Africa in terms of GDP per person, about $770 per person. So very, very poor country. But the government, they've applied to GAVI, they've gotten GAVI financing over time, they've committed 5% of the money to the pentavalent vaccine. And what that has allowed them to do is at the same time the government recognized the issue that they had to train health surveillance assistants, very inexpensive people to work out in the village. They've now trained 11,000 of them. They work out in the remote rural villages, which is where 85% of their population lives. They have a population of about 13 million people. Well, these health surveillance assistants work 3 weeks out in the rural village, and then they move into the clinic or the nearby hospital and work 1 day a week out of there. So they're doing the immunizations 1 week in the clinic or the hospital. They're doing a few out in the village, but they live out in the villages, so they're in constant communication with the mothers and the parents in the village. And so they can reinforce all kinds of things, not just getting the basic immunizations, which is really, really important for the childhood under 5 deaths. But, when we look at these childhood deaths and we say, okay, in the 1960s there were 20 million childhood deaths. We're now, as of 2008, are down to about 9 million childhood deaths. Of those 9 million, 4 million of the the deaths of under 5 are in the neonates the first 30 days. Well, these health surveillance workers can really be out in the villages giving the messages to the moms. You have to get to the clinic 4 weeks ahead, which is what the moms are doing now, to deliver your baby. And yes, you wait around for 3 or 4 weeks, but the difference between a mom being in the clinic to deliver her baby is literally the difference between life and death for her and that newborn. So you can link up everything that's happened from the immunization goes all the way back out in the rural villages. So they're going to start to be able to bring down their maternal death rate and their neonatal death rate. And that's when you see the system working all the way through. And if you say, if it can be done in Malawi, it can be done in a lot of other countries.
Yeah, and I think it's an incredible example of how one intervention can really be used to spur changes across the whole health system. So it would be great to hear from others also. This has been a very particular experiment. It's been focused on getting new vaccines out, strengthening the systems. It has a fairly focused approach and a focused agenda. But as you said, Melinda, it's a way of actually also having broader impact. Does this model, the GAVI model, what aspects of it would work for other health challenges? What pieces of it have we learned that we could possibly use for whether it's maternal mortality, non-vaccine preventable diseases, and also from an industry perspective? But I'm just going to ask you all to chime in when you want. From an industry perspective, what does the GAVI model say to you about ways in which industry can engage in some of these big health issues? So take it away.
Well, I think one of the important things we have learned over the years, and I'll go back to the Botswana experience where Merck and the Gates Foundation has worked in Botswana for over a decade now. And it was easy to get the product to the country. What wasn't easy was building infrastructure, like Melinda said, whether it's free clinics, whether it's education, whether it's healthcare professionals, whether it's teachers. That took a long time to do, and I think those experiences will help us with the GAVI experiences, particularly as we go forward with HPV. I think that's going to be important sequencing to get that right as we move forward. But now, if you think longer term with chronic diseases and where we're headed with obesity and hypertension and issues like that, to use this type of model to take that on as a potential new frontier, to try to get ahead of all of that and get into preventiveness and wellness from an adult standpoint and an elderly standpoint would certainly have an impact, not only the well-being and the health, but the issue around the healthcare cost within these countries, to be able to bring that down. So I think that's important. From an industry standpoint, industry engagement is critical. And I think one of the successes we've had with GAVI is to bring the industry in earlier, to have those dialogues and debates and discussion so that we're able to get that idea and that strategy and that long-term planning done correctly, because we truly want to be at the table and we all have the same mission and same values. The one issue that still is a concern to us is tiered pricing. Mm-hmm. We have a very serious concern over making sure that the GAVI countries get the lowest possible price, a non-for-profit type price. And then you have middle-income countries wanting that same price as well. That's a threat. And we have to be able to solve that quickly in order to keep that sustained movement towards the proper relationship between the industry and GAVI.
I think one of the characteristics, rather than saying product-driven, I would say results-driven. And I think that's one of the lessons for other partnerships and organisation is, okay, you have the delivery platform, but what's it there to focus on deliver with a series of results that's going to maximise health impact? So I think that remains absolutely valid. And I think how you then measure that result remains a challenge. I think there's more that we need to do there, and particularly as we begin to move more into results-based financing, where we're thinking through, as GAVI did in the early days and continues to do, how do you reward excellent performance and begin to incentivize management systems and delivery systems to do that. And I think there's a lot of potential there. But I really would like to echo creating these broader partnerships as early as possible with key stakeholders that can make a difference. Really is a vital thing about GAVI, and is a vital thing about other interventions, whether in maternal health or in other areas of child health. These are not going to be solved by one actor. I think that's one of the things we've learned from GAVI, is bringing together stakeholders and then getting it country-driven, having the ministries. And that's been the success of GAVI. I mean, the success of GAVI is not the funding, it's not the product. It's actually the countries themselves that take ownership, leadership, and use GAVI, use our finance and the products that we're able to supply to deliver results for their people and be able to demonstrate that they're making progress.
And it's a good point. I think it's an important point because, again, I think there have been critiques that GAVI's too top-down, doesn't involve the countries as real partners. And I think the kind of examples that you've given, in fact, show how that partnership, maybe it didn't start perfectly, but how that really has emerged over time. Melinda, you look like...
Well, I was just going to say, I also think the model of GAVI and people seeing this public-private partnership really work, even in the early days, and there were things to work out, I do think was an inspiration for the Global Fund. And I think, and the whole mechanism for public-private partnership through the Global Fund, and then working, with country coordinators and countries, up to applying to the fund and the funding going out. And then again, Global Fund looks at, and they don't structure it in the same way, but they say, okay, GAVI's been, done this, very innovative type of financing. What can we do that's innovative kind of financing that will support Global Fund, either through the Global Fund or on the side of Global Fund, that will give money? So Global Fund is focused on AIDS, tuberculosis, and malaria. They've got, just like GAVI, they've got a very specific mission and goal. And I think seeing that a public-private partnership can work made people willing then to, again, large-scale government investments, willing to invest in something like the Global Fund.
Mm-hmm. Do we need GAVI's and Global Fund for every health issue we're trying to tackle, or how do we use what we have from these new mechanisms that can really help extend our ability to make an impact more broadly? I don't think that we necessarily have the resources or appetite for having a GAVI or a Global Fund for every single disease that we're trying to tackle. So.
Yeah, I don't either. And I think particularly in these times of recession, when all government budgets are facing, pretty large crises, the message to them is the institutions that have been set up are really working. We need to keep the funding as is or increase slightly, not decrease. I think that's going to be very difficult in the next 5 years. So to go and ask for a new type of fund, I just don't think is realistic. But I think trying to get the success messages out of where this has worked, and then talk to the countries. There are great countries doing also specific, this is all multilateral work, but doing some bilateral work around specific goals, maybe around maternal and child health, that are in conjunction with the work that's happening with Global Fund or with GAVI. I think that may be the way to go on maternal health. I don't think we have that solved yet, but I think we have to be very realistic about where governments are today with their financing.
Mm-hmm. Yeah, Mr.
I would say the sheer number of institutions like GAVI is not very important. I think what we should be talking is that any major disease should have a funding mechanism like we have in GAVI. Like Dick said just now, on Wednesday we were talking about chronic diseases, and someone remarked that even in the MDGs, chronic diseases don't appear anywhere. And the suggestion that came out, which I agree with, is either we start a fund, a standalone fund, or we can merge it to some other funds which are there. What we want is to give a focus to those diseases which there's little that is being done in terms of financing, and get the global community to support, particularly the underserved countries like mine.
Right. So, yeah, Julian, go ahead.
I think another approach is the more coordinated harmonization of different efforts, led by national strategies, and being very careful that everything that GAVI does or the Global Fund does isn't undermining or distorting priorities at the country level, but is actually reinforcing more integrated ways of support. And we can do that. And as you know, the Global Fund, GAVI and the World Bank have come together to see how can they better coordinate their efforts around some of the platform and system building. And I think that's another way forward, because I think the minister might be being quite polite here as well, but I know that many ministers suffer from 200 visits a year from different institutions and initiatives and NGOs, which can itself be paralysing. And I think we've got to change the way we do that business. So I think the more that GAVI, the Global Fund and others can be sensitive to those issues and structure our finance and our support, and through the partners that work at the country level, in our case WHO, UNICEF, have a vital role in ensuring that our support is supportive of what's going to happen in maternal health and not undermining, and that resources that we're providing are supporting initiatives in that particular area.
And I think as the governments, just as you're saying, I mean, when you go on the ground in Ethiopia, again, a lot like Malawi, they have 30,000 of these health extension workers, and they literally have a framework, as does Malawi now, to help slot the partners in to say, okay, this is who's already on the ground working in X number of our districts, and these are the places that would be helpful as you come in as a bilateral donor to really fill out our framework. This is where we still have holes that need to be filled in. It absolutely, though, has to come from the governments. I completely agree.
Yeah, so more funding, more focus, more results, but not necessarily more mechanisms.
Correct.
Figure out how we do a better job of integrating what we have, but make sure that the resources are there and do what we need to do to create those kinds of resources. Yeah, Julian.
And I think also understand what are the, I don't like the word, but I'm going to use it, comparative advantages of different institutions. GAVI was very much set up to work on global public goods, to work with industry and the markets, to shape new product coming in faster at better prices. So understand that's a separate added value at the global level, which I think gives a good rationale for GAVI's other separate role.
Great. Well, I'm going to switch gears for a moment. We're going to show another very short video, and this is one, we've been doing a lot of talking about mechanisms and how things work, but in institutions. But what we really want to do is to show a little clip of a film that the Gates Foundation produced that shows the evolution of a new vaccine, and this is the rotavirus vaccine that Merck was able to develop and make available. So we want to show a little bit about that, and then we want to open it up to the audience for question and answer. And I have a couple people I want to call on particularly. I'm going to start with you, Ian Smith from WHO, because unfortunately, since Margaret's not here, we would like to hear about WHO's view of this as the World Health Organization and how a mechanism like GAVI helps or doesn't help what you're trying to accomplish. All right, let's see the video.
3 years ago, we had high rates of diarrhea and severe dehydration. We had so many cases that we'd have 2 babies sharing one bed. And it was hard to lose so many of our kids to rotavirus.
My daughter's name is Scarlett Sarai Alvarez. She's my princess. We are here because she's sick. She's vomiting and has diarrhea. As a dad, I work to protect my kids, but sometimes I worry.
We started working on this in 1980. It took us about 10 years to figure out how to make the strains that ultimately became the vaccine. In 1990, we went to Merck, and they did the research and development over a period of about 16 years. And the trick is being able to get that vaccine from, in this case, this manufacturer in the United States, into the mouths of children in the developing world, and that's hard. Well, the rotavirus vaccine needs to be refrigerated. It needs to be refrigerated on the way to the country. It needs to be refrigerated while it's being delivered to the clinic. and then it needs to be refrigerated really right up into the time that it's given to the child.
When this vaccine arrived in Fantasma, the number of cases of diarrhea dropped. Today, we don't have a single child admitted into a rotavirus ward.
We are going home today. If she hadn't been vaccinated, she'd be a lot worse. She's 2 years old, and I hope she grows to be a strong and determined woman, a superstar. Right, my love?
Hard not to feel good about that. So I'm going to turn it over to the audience, but I would like, Ian, if you wanted to say a couple of words from the standpoint of WHO, and how has GAVI fit into what WHO is trying to accomplish in child vaccinations?
Thank you very much, and thank you for the discussion so far. Been very, very interesting. Again, Dr. Chan sends her apologies that she's not able to be present. She would have loved to have joined this, and I know she would have wanted to send her congratulations to GAVI on the 10 years, and also to warmly applaud the extraordinary announcement today from the Foundation on the support to vaccination. I think I also know that what she would have liked to have said would have been to say how we've learned from the experience with GAVI over the last few years, and what are the key lessons that I think not just WHO but the world has learned from this experience, and perhaps just focusing on three specific ones, some of which has come out already, but perhaps not entirely. First of all, the value of partnership. And interestingly, partnership has been critical to vaccination even before GAVI. The 80s and the 90s, partnership has always been a fundamental element of success in immunization. But we've not always done it very well. There have been mixed experiences with partnership over the years. And I think what we've learned through GAVI is ways of doing partnership well. And that's been really critical to the success. A second thing we've learned, I think, is the value of innovation. Not just innovation in terms of product, new tools, but innovation in different ways of working, innovation in ways of financing, getting additional resources, innovation in ways of working to increase access to vaccines, to the ADIPs, for example, in the past, the focus on results. All of these innovations are now being used in areas, as we've mentioned. And then perhaps the third thing that's been so critical has been the value of delivery systems. And I think immunization programs are often the backbone of health systems in many countries. They're not just delivering immunizations, they're not just delivering vaccines, they're the basis on which many families, many children get micronutrients, get mosquito nets, get all sorts of other antibiotics, etc. It's often been the backbone of a development in the health system, and it's contributed to better health planning, better surveillance, better monitoring, better laboratory standards, etc. So I think we've learned a huge amount through immunization programs and through the support that GAVI has provided to them. But as we look to the future, I think there are again perhaps 2 or 3 challenges that lie ahead. And some of them have come out already. One of them is this issue of, well, we clearly need resources for other areas other than just vaccines and HIV, TB and malaria. So how do we take the lessons of GAVI and replicate them, not in creating new funds, new global funds, but how do we get the existing mechanisms to get more funds, but also to then address other critical issues like maternal mortality, NCDs and so on. The second challenge is how to move from a dependence on donor resources to country-owned, country-led, country-resourced programs, where not just the products are being bought by the countries with their own resources, but in some cases even being produced by the countries. The transfer of technology that's needed into countries. How can we facilitate that in the longer term? And then finally, how can we've made great progress, but we've clearly got a lot further to go. We've got 9 vaccines out there, but we've got at least another 10 that are not really widely used. And obviously we need to be not just sustaining the current achievements. We need to be going way beyond them. And what's that going to take? So there's a number of challenges that lie ahead. Lots to be thankful for, lots to celebrate, but also a lot more to do in the future.
Great, thank you. We have about 10 minutes for questions, and I'd like people to keep questions as brief as possible so that our panelists have a chance to respond adequately. So I'll take the first question here, and yes.
I have a comment and then a question. This is in support of what Mr. Clark and the Honorable Minister mentioned about the chronic disease management. More than 50% of people in emerging markets die of chronic diseases today. It was earlier only a developed countries phenomenon. It's spreading very wide. And this can be prevented and reduced enormously through education, through communication, and also a low-cost early diagnosis. So I think it is an area which has not been there in any of these health management programs. And the kind of impact it can make in reducing health costs and saving lives could be enormous. So my thought is that is there another model if we are looking at in future in next 10, 15 years? Is this area one should look seriously in terms of doing chronic disease management? There's a question I would like to ask you.
Yeah, I think broadly speaking, I think the question of how does this model potentially, can it be extended for other things like chronic diseases, which we know are clearly causing a huge health burden in emerging markets and emerging industries.
Yeah, certainly, I know the Governor's Healthcare Committee and Conference of CEOs across the world are taking this on as a primary project and as a pilot to think about chronic diseases in many of the emerging markets. So we certainly don't have a solution yet, but we're taking it on as a project and ideas about what the future should be, and certainly looking at the successes of other organizations and other funding mechanisms. And the infrastructure you need to be able to accomplish this is something we're taking into impact. So hopefully by next year at this conference, we actually have some updates on that.
Next question.
Justin Picard with Advanced...
Feel free to say who you are and who you represent. Okay.
Well, I'm Justin Picard with Advanced Track and Trace. My question is on the problem of counterfeit medication. You have some countries now with 50% counterfeit medication, so medication that don't heal or can kill the patient. You have an estimated 700,000 people dying because they have been treated with counterfeit medication for malaria and tuberculosis. There starts to be evidence that counterfeit medication have promoted more resistant strains for malaria, so that could make it more difficult to eradicate this disease. So my question to the panel is it a concern for you, and what are you trying to do to address this problem, which is growing and growing every year?
I mean, I think on the vaccine side, it's a rather different market that you're dealing with, and we haven't in GAVI faced any of those kinds of problems yet. Doesn't mean to say we won't in the future. But one of the ways we manage this is WHO pre-qualifies manufacturers so that we know that we're getting quality product. UNICEF does most of our procurement, and therefore they really ensure. What we can't have is a single bad vaccine in any country in the world. The ramifications of that are enormous, as we know here in the West, but everywhere else. So we pay very close attention to that.
Hello, Jamie Drummond of the global anti-poverty organisation One. Some of the statements up on the screen behind you, Julian, imply that GAVI's fully funded through to 2015, and the heroic commitment this morning of the Bill and Melinda Gates Foundation would also suggest that this issue is well financed. But in fact, that commitment should be matched and more by governments. Maybe you could articulate exactly how much you need, what is the financing gap, where is it going to come from? How can groups like One, who think GAVI is amazing, help?
Yeah,
and before you start, Melinda, would you just, for those who haven't heard your announcement from this morning, would you just repeat what you actually, the wonderful announcement you and Bill made this morning?
Yeah, so Bill and I made an announcement that we're going to commit $10 billion over the next decade to basic immunizations, to get, the basic packages out there, and also to get new vaccines created and out to the developing world.
Yeah, fabulous, fabulous announcement.
notwithstanding that generous contribution to vaccination broadly, there is a real challenge. You're quite right, Jamie. Let's be absolutely clear about this. GAVI is sufficiently financed, you're quite correct, through to 2015 for our existing programs that we've committed to countries, which is very important. This is part of our long-term sustainable commitment to countries. But all our ambition for the future, whether it's pneumococcal vaccine, whether it's diarrheal vaccine, whether it's HPV in the future, is going to be dependent on the success in mobilizing finance. And that challenge since the economic crisis is a tough one. But the kind of momentum created by the Bill and Melinda Gates Foundation leverages others. And we need to work very hard to do that. Now, we have amongst the most cost-effective of interventions, the most affordable of interventions, we have a very strong message to be able to say this is where focus should be in child health in these areas. And we have a great track record. So I have a lot to build on. But it is challenging. We look to organisations like one and others to work with us to mobilise that finance, and particularly civil society. I think, if we're honest, in the HIV world, there's a strong civil society, which is fabulous, which has helped mobilise finance, keep the pressure up. And we'd like to build the same thing for child health and for maternal health, I would like to say as well. And we need to build that same constituency because it's just as vital and just as important. Every year, more children die from pneumonia than die from HIV, TB and malaria. Now, I'm not saying don't do HIV, TB and malaria. I'm saying absolutely do that. That needs to be financed. But let's rebalance with financing to other very important MDG areas.
Yeah, and I hope, this session and seeing the successes after 10 years, part of what we do from here is to go out and continue to put the pressure on to keep the momentum going, because 10 years of success is not enough. We've got to, this has to be a rallying cry in many ways. It's great to talk about 10 years of success, but it's because we sustain the successes that this 10 years will really make a difference. And I think that advocacy part, and I look to Melinda for the living proof and what you're doing through telling the kinds of stories that you're telling that give people the hope that, in fact, if you can make a difference, I think that's what gets people mobilized to do more.
Yeah, and we have to be serious. This has to be, large government funding that comes in, and advocacy groups. I mean, what one has done for the Global Fund to keep pressure on governments, to keep governments honest about what their commitments are, but also to create new financing, which they've done, through Product Red, to get businesses signed up so there's a certain amount of their profit from, Armani products, Gap products, Hallmark products goes towards the Global Fund. They've raised over $100 million for Global Fund. That's something, nobody dreamed of 8-10 years ago. So we're going to need more help with advocacy and creative ideas of how do you keep even private money flowing towards mechanisms like GAVI and Global Fund.
I think we have time for one more question, and then I'm going to ask the panelists to just kind of maybe give one last comment on what do you want this audience to leave here knowing about GAVI and the successes, and how we can take forward the successes of GAVI to more broadly have an impact on health. So, Francis Collins.
Yeah, I'm Francis Collins, the director of the National Institutes of Health in the United States, and I want to express again congratulations to GAVI on this 10th birthday and to the Gates Foundation for this amazing announcement today. Global health is one of the priorities I'd like to set for NIH in the coming years, and one of the challenges is to figure out where are the gaps, and we had a meeting about 3 weeks ago that I think helped identify some of those. As we hear about the progress that's being made with vaccines, and it's really quite exciting, it seems like we should be planning for success in every possible way. NIH's investment in vaccines is largely in the discovery and development phase, and we spend about $1 billion a year on that when you add up everything that's going into HIV, tuberculosis, malaria, influenza, et cetera. But we don't, in general, have as part of our mandate, because we're a research organization, the delivery part. So my question is, do we have a good assessment of whether the impedance matching is optimized? If we imagine new vaccines getting developed in the coming years, and it seems quite likely they will be, are there predictable rate-limiting steps that will block, for a longer period than you would like, the ability to get those in country where they are most needed? And if so, what are we doing to try to anticipate what those obstacles might be and knock them down?
Great.
And that's part of the sort of design.
Panel. Yeah.
Part of the design for GAVI was to shorten that time frame, and using innovative mechanisms such as the advanced market commitment to get a pneumococcal vaccine 3 to 5 years faster than we would have done otherwise. But I completely agree with you. I think a better analysis of those rate-limiting steps as new vaccines and new products are coming through needs to be done. There's a lot of lesson learning still to be done in GAVI, but I think it's a critical point you're making.
And maybe from the country perspective, we've talked a lot about these mechanisms, but clearly at the country level, there are real obstacles. There's the health workforce, there are systems. Maybe if you want to say a little bit about where you see some of the obstacles from the country level.
You mentioned some of them so eloquently. For instance, I have one doctor to 30,000 people. But for every level of health workforce, we have very few of them. And the majority of the people like to live in towns. 80% of my population is out there in the rural areas. Even those we train wouldn't like to work in the rural areas. So we are incentivizing them, we are improving conditions, because rural means poor, no roads, no running water, no electricity. So it's not just a health issue, it's a whole government. My colleague has to build roads, we have to get good transport, and so on and so forth.
Great. Well, we are about at the end of the time, but I really would like to give each of the panelists just a moment to just say what's your big message you'd like to leave the audience with. And I'll start with Dick Clark, and I will just say we mentioned several times HPV, and just to recognize the role that Merck has played in already trying to jumpstart some of the work and getting that vaccine available in developing countries. But everybody, what's your last thought that you'd like to leave the audience with?
Well, certainly from a Merck standpoint and an industry standpoint, our commitment and our excitement now about the ability in basic research and clinical development to not only think about vaccines for the developed world, but at the same time think about them as for the developing world. So when these vaccines are approved in the developed world, they are approved at the same time for the developing world. And in fact, there's been a lag in that in the past. We can't have that happen anymore. So our mission and our values is to make that happen in the future. And I think the second important thing is access. We've got to make sure that the pricing is right from an access standpoint. It does no good to create a wonderful vaccine and then patients and governments cannot afford it, and that's our commitment as well.
Yeah, if I could leave one thought with the group, it's this. This type of aid, this health aid, is incredibly effective, and it works. And we now have evidence. I mean, we don't have to sit around and debate anymore. We know we're saving lives. And so getting stories out there about how it's working, what we see, so that we can keep donor commitment up, both from private companies, individuals, and governments. If we can get the stories out there and keep the message in front of people, this is important and we need to keep at it.
Very briefly, I was sort of targeted at Jamie a bit, but the audience in general, how do we get the messaging right? Because the wrong message is we need loads more money. Yes, we need more money, but it's in a context of a design of GAVI that also looks to a long-term financing scenario, one where governments gradually increase their co-finance, and we need to understand the ability to pay better so that we can differentiate that response. But also how we shape markets and get the right product so we can drive down prices as well in different ways. So as prices come down, as governments' budgets go up and as co-finance increases, that is the out for GAVI. But there's a time frame for that, which will vary for different countries. Get that messaging right, and that's a very powerful message to convey to donors to invest in GAVI and to put more money at this time. And I think we still need to work at really learning the lessons and the time frames in different scenarios to convey that message.
I personally would like to applaud the spirit on which GAVI was founded. Here we have a set of conditions, health conditions, and I think what has been manifested is that health is a global issue, because starting a fund like we have in GAVI, the majority of the people here, and even those who put in the kit, have never suffered from these diseases. But it's just because a health situation in one part of the globe is a health situation in your part of the globe. And I think I would thank, on behalf of we as beneficiaries, I would like to keep up the spirit. And we have mentioned that there are so many other disease conditions. GAVI is there for us to emulate, to try to fight health conditions together as one family in the world. Thanks.
Thank you. And as your moderator, I just want to thank all of you, the wonderful panelists, for your presentations, the audience for your great questions. As a health professional who now works in a development organization, I must say that, I continue to believe that our investing in the lives of children around the world is one of the most important things we can do. So it's been my real honor and pleasure to be part of this and be part of this incredible 10-year anniversary of this success story. So thank you all.